Hi everyone, it's Dr. Jhawar with Revive MD. I want to talk a little bit about insomnia today. Many people suffer from insomnia. It's such a common condition, and I see patients for this all the time. And I saw an interesting article recently that looked at women in their 40s and 50s who were suffering from insomnia and how much of an increased risk they had for cardiovascular disease. And this study was actually done over an extended period of time, many years, and interestingly, but not very surprising, that there was a 70 to 75% increased risk for cardiovascular disease. That's pretty high, actually, and in young women in their 40s and 50s. So insomnia is a really big problem. Many people suffer from it, not just women. And I thought I would break this video up into two parts and talk about some of the lifestyle modifications that I recommend to improve sleep or to kind of set your sleep in a better rhythm. But also I'll have a separate video on supplements and medications that I recommend to help improve sleep. So one of the big things when people come to see me for insomnia evaluation, and because of those symptoms they're having from it, whether it's problems initiating sleep or broken sleep or waking up way too early and then having trouble falling back asleep again, whatever it may be, few of the things that I do assess and look at are, well, what are their other medical conditions? What other medications are they taking? Because sometimes those can interfere with sleep as well. Whether or not they have tried other things, in the past to help them with sleep. What are the symptoms that are actually keeping them up or disrupting their sleep pattern? That's important. And whether they need to be evaluated for other conditions like sleep apnea or other sleep disorders. Now, after having done that, we do talk a lot about lifestyle modifications that that can really help with improving sleep. So the first thing is really setting a sleep schedule. Now, this is really hard for a lot of us, but myself included, but really having a set time that you want to be in bed and go to bed, and a set time for waking up in the morning. This will help you kind of stay in a certain pattern and a proper rhythm and kind of help your circadian rhythm. The second thing is, before bedtime, you don't want to have things like coffee, teas that have caffeine in it, or their energy drinks, because obviously that's going to disrupt your sleep. But also things like drinking alcohol right before bedtime, smoking, nicotine has effects on sleep as well that can be bad. And then of course, other things like maybe, limiting your exercise to during the daytime or in the morning instead of exercising in the evening, because that can also disrupt your sleep cycle. When you do get to your bedroom, now this is a tough one for a lot of us, myself included, but trying to really, really limit screen time once you're in bed. So that means, turning off your phones, turning off the TV, don't be laying in bed watching TV, and also, limiting computer usage, and laptop usage during bedtime. And the reason is that the glare and the light from that can actually depress and suppress your melatonin levels. And your melatonin is your natural hormone in your body that really helps your sleep cycle. And you want that to be elevated at nighttime because that will actually help you to feel sleepy and to get, into a good rhythm of sleep. So it is really important to limit that screen time. Also, other things that can help is maybe having like a white noise machine or some kind of noise in the background that's, lower volume, that can help you kind of, relax and make you calmer and actually help you to get restful sleep. So I hope this helps you, to get a few ideas that can get you started. But all of these little changes and these habits will help you and build up, over time to help you get better sleep. All right. And I'll be back with another video to talk more about supplements, over-the-counter medications, and prescription medications for insomnia.